Restoring knee flexion is really important for being able to get up and down from a chair, being able to perform steps for going up and down stairs, walking more normally, even squatting down. Our knee needs to be able to bend a sufficient range of motion for us to be able to access those functional motions. So if you're dealing with stiffness and if it's predominantly, it feels like it's blocked, tight, restricted, those types of words, this might be a good addition to your normal exercises to add on. If it's significantly painful, you might want to focus more on pain management first before you focus so much on mobility, because if it's pain dominant, it's going to really limit your ability to access the end ranges of motion, and you might be just too guarded and uncomfortable to even perform these. So just take that into account. So a good long duration stretch to restore knee flexion is using a towel and laying on your back. So what I'm going to do is I'm going to position this towel in the back of my knee, and then what I'm going to do is hold my hip, and I'm just going to allow my leg to bend over this towel. And when we're trying to restore range of motion, it's always good to have a low load, so not super aggressive or high intensity, but longer duration exposure to the motion. So I'm going to hang out here for about 3 to 5 minutes as tolerated, ultimately building up to anywhere from 5 to 10 minutes. And you can do that in a number of different intervals and breaking it up throughout the day. But a cumulative stretch time of about 30 minutes if your knee is really stiff is needed to restore that motion. Some people certainly don't need that much time, but others who are dealing with a really stiff knee certainly need to get that exposure to make some true changes in mobility. Now, what I can do is to increase the intensity, I could reduce the thickness of the towel, so you'll notice my knee will bend more, and then just hang out in that position. Now, if this is not too irritable, definitely don't want pain to be increasing, but you can add some overpressure with your hand. And I'm just using the weight of my hands, I'm not pulling, so just resting my hands over my shin, and that's gonna allow for a little bit more of a intense stretch to get a little bit more out of it. Again, just monitor your symptoms to make sure that it's not irritating.